Today is December 10th, 2020, and the COVID-19 pandemic has been going on for a little less than a year at this point. It has been around 9 months since this virus first started affecting the United States badly. March of this year, March 2020, is when the daily case count and death count first started spiraling out of control in this country, and ever since then, things have been pretty bad, but there is some good news. Today, the FDA board just approved the Pfizer slash BioNTech vaccine. The United Kingdom already did that a few days ago or a week ago, and they've already been vaccinating their citizens for the past couple of days. But the United States and the FDA finally approved of the Pfizer vaccine today. They finally gave the green light on the Pfizer vaccine, so now, soon enough, people in the United States can start receiving this vaccine. The vaccine will first go to people who are most at risk of either contracting the virus or most at risk of dying from this virus. So this includes healthcare workers who have to work with COVID-19 patients on a daily basis, people who are of old age because this virus affects people who are older aged the most. So people, especially above the age of 65 or 70, those people are the most likely to die from this virus if they get it, and people with pre-existing health conditions that put them at major risk of getting severely harmed from this virus, because people with pre-existing health conditions, especially more severe ones, they are a lot more likely to die from this virus than the average person if they contract this virus. So the vaccine will go to those people first. I think that the timing of this is pretty good in that we were able to get this vaccine out in less than a year, which is basically unprecedented. No other vaccine for a novel disease has ever come out in the span of less than a year. For the Ebola vaccine, that vaccine took 5 years to create after the 2014 Ebola outbreak, and that vaccine was created just last year in 2019, I believe. But for the COVID-19 vaccine, that was created just under a year after the virus first started spreading to humans. I guess now it's been slightly more than a year since the first cases of this virus popped up in China, but most people they didn't even know about this virus until like early January, mid-January. So, in that aspect, it's been less than a year. So the timing is amazing on this, but also, the timing is not that great in that we're right now in the middle of a giant spike in the United States in terms of the daily case count and death count, not only in the world, but not only in the United States, but also across the entire world. There is a major spike in the daily case count and the daily death count, and there's also a lot of countries besides the United States that are also experiencing these spikes. I've noticed a general pattern actually. All the countries that are in the northern hemisphere, for the most part, are experiencing a new spike or have been experiencing a new spike for the past couple of months in the case count, daily case count, and daily death count. And I believe the reason for that is because in the northern hemisphere, it's about to be winter, it's late fall, and it's about to be early winter. And because of that, in most places in the northern hemisphere, the temperatures are a lot colder now than they were back in the summer. And because of that, a lot more people are staying indoors more. As a result of this, the virus spreads more. The reason for this is because the virus spreads quite a lot more easily indoors than it does outdoors. It has been shown that the virus spreads noticeably more easily indoors, in indoor settings, than it does in outdoor settings. And since it's about to be winter now, it's cold outside, more people stay indoors, the virus spreads more, you have all these spikes. So I've noticed it's a pretty common trend across countries in the northern hemisphere, but countries in the southern hemisphere don't seem to be experiencing the spike, and that's probably why. It has to do with the geography, it has to do with the location of the country on this planet. Countries like Australia and New Zealand are having basically no spikes at all, but that also has to do with the fact that Australia and New Zealand handled this virus very well in the summer. But one of the consequences of the spike is that some states in the United States get affected especially badly by it. And you can see on screen now, I have a list of a bunch of different states that are doing badly with this virus, but I'm not really ranking them on screen. They're not really ranked by the number of cases that each state has. But if you look at the far right column, that's actually the metric that they are ranked by on screen right now. Basically, I ranked each of the states. I believe on screen is the top 10 states or top 8 states. These are the states with the highest percentage of their population having this virus. So the exact metric that is being used to rank all these states and this metric that's being used to put North Dakota and South Dakota at the top, it's actually the number of COVID-19 cases per 1 million people in that state. So basically it's asking out of 1 million people, how many people out of those 1 million would have the virus. So if you took a random sample of 1 million people from that state, then how many people would be expected to have the virus out of that 1 million sample? Or how many people would be expected to have tested positive for that virus sometime in the past year, ever since this pandemic has existed? So if we go down the list, you see North Dakota and South Dakota at the very top. Then you see Iowa, Nebraska, Wisconsin, Utah, Montana, Idaho, Wyoming, Rhode Island. Those are the top 10 states on this list. And number 10 is Rhode Island, and out of 1 million people, for every 1 million people, there's around 65,000 cases. As in, if you took a random sample of 1 million people in Rhode Island, then you would expect around 65,000 of those people to have tested positive for this virus during the course of this pandemic. Now, I'm actually not sure if Rhode Island itself has over 1 million people, but even if the state doesn't have 1 million people, it's basically assuming how many people in that state would have the virus if there were 1 million people in that state. That's a good way to think about this. In each state, if the population of that state was 1 million people, how many of those people would have tested positive for this virus during this pandemic? And for Rhode Island, it's 65,000 people out of 1 million, which means that if you do the math here, 65,000 over 1 million, that's around 6.5%. What this means is that throughout this pandemic, up until now, around 6.5% of the people living in Rhode Island have tested positive for COVID 19 sometime during this pandemic. And on this list, Rhode Island is number 10th in terms of the percentage of the population that has gotten this virus. But if we look at which states are number 1 and number 2 on this list, we see that it's both of the Dakotas. North Dakota is number 1 and South Dakota is number 2. And these are actually the first two states in the country where over 10% of the population of those two states have tested positive for this virus sometime during this pandemic. If we look at South Dakota, if we look at the chart on screen, under total cases per 1 million population, it says 100,295, so approximately 100,000 people. If we do the math, 100,000 over a million is approximately 10%, which means that right around 1 in 10 people living in the state of South Dakota have tested positive for COVID 19 sometime during this pandemic, meaning sometime in the past 9 months or 11 months. That means that 10% of the population has tested positive. That doesn't mean that only 10% of the population has actually gotten the virus. It's possible that there's a lot more people that got the virus, but they were either asymptomatic or they had mild symptoms, and as a result, they didn't feel the need to get tested, but they still had the virus, meaning that the percentage of the population that actually had the virus would be higher than 10%, but the percentage of the population that tested positive for the virus is only 10%. Now, if we look at North Dakota, it's even higher than that. Under the total cases per 1 million population metric, it is listed as 113,000 approximately. And if we do the math here, 113,000 over a million is approximately 11.3%, which is even higher than South Dakota, and it is the highest across every state in the country in terms of the percentage of the population in that state that has gotten this virus, or sorry, that has tested positive for this virus. Key word tested, because you're not going to know if you have this virus unless you get tested, but it's possible that you get this virus but you don't know about it. So 11.3% of the people living in North Dakota have tested positive for COVID 19 sometime during this pandemic, which is actually pretty insane, especially considering the fact that North Dakota itself is a pretty sparse state. It's mostly rural, meaning that you would think that people living in North Dakota wouldn't interact with too many other people when it is a pretty sparse state and everything's spread out, but for some reason, there's been a lot of cases in the past couple months, and I'm actually going to show you that chart now on screen. So now the chart for North Dakota is on screen. This is basically the chart of the daily case count for North Dakota across the past 10 months, I believe. It starts from March, so it's actually the past 9 months. But you can see in the first few months, the state actually had virtually no COVID 19 cases. If you go from March all the way up until July or August, there were barely any cases during that time frame. From March to like June, there were essentially no cases every day. It was very small amount. It wasn't actually zero, but it was less than 100 cases per day. And compare that to what we're seeing now with over 1,000 cases per day for the most part, but we're going to get to that in a second. So if we look from March to June, we see less than 100 cases per day, which is a really low amount, but that would also be expected from the state, considering the fact that it is a sparsely populated state. For its size, it has a really small population. I believe the population of North Dakota is less than a million, and that is why it only has one congressional district in Congress, but the land area is pretty big for its population. For reference, New Jersey has several million people, but the size is only a fraction of that of North Dakota. North Dakota and South Dakota are pretty similar in terms of their population and geography. Both only have one district, one congressional district, both only send one member to Congress, and both have a population smaller than a million. They both also have a similar land size, so both states are similar in terms of their geography and similar in terms of their demographics, but they are both now experiencing massive spikes. So I'm showing North Dakota on screen. I'm showing the stats for North Dakota on screen, but South Dakota is mostly similar in terms of the time frame of this virus getting out of hand for both of these states. So spring and summer, when most states were experiencing one spike or another, in the spring it was New York, New Jersey, all those northeastern states experiencing a spike. In the summer it was a lot of southern states experiencing a spike, but a lot of states were largely spared by those first two spikes. A lot of Midwestern states were largely spared by those first two spikes, especially states like North and South Dakota. You can see that they were virtually untouched by both of the first two spikes of this outbreak in this country, but once late summer, early fall came around, that quickly changed for both of these states. North and South Dakota, for both of these states, the virus quickly spiraled out of control. And I can actually point to a major reason why that could have been the case. It is actually because of the Sturgis. Sturgis, is that how you pronounce it? I think it's Sturgis. Yeah. Sturgis Motorcycle Rally. Basically, this is an annual rally with thousands of people across the country, mainly from North Dakota and South Dakota. The event itself takes place in South Dakota, but there are thousands of people there, and they have large gatherings and they have all sorts of events. And usually that's all fine. That's all, nothing wrong with that. I don't see a problem with that usually, but this year that was different. This year it actually was problematic because most people there did not wear masks. Most people there did not socially distance. There were also lots of crowds there, and overall, most of the people who attended that event were clustered pretty closely with many other people, and that was the perfect breeding grounds for a massive outbreak in that geographic area of the country. And that might be one of the reasons why you saw major spikes in late summer, early fall for North Dakota and South Dakota and also the surrounding states. Obviously, this is far from the only reason why there is a major spike taking place in these states. Otherwise, states like Texas wouldn't be experiencing a major spike. States like California, if that was the only reason why these spikes were occurring, then most of the other states in the country would not be experiencing that spike. But obviously, we know that's not the case. California, Texas, Florida, basically every state in the country, with a few exceptions, is experiencing a giant uptick in the daily case count and death count. But I can say for a fact that the motorcycle rally definitely did contribute to the uptick in the daily case count and death count, especially at the least in North and South Dakota, if not some other states as well. But if we look at the daily case count, it was at its peak in early November, early to mid November, and on one of the days in November, it actually surpassed 2,000 cases in a single day. And for those of you guys who don't know, the population of North Dakota is only around 600,000 people, 600 to 700,000 people. I don't know the exact number, but it's somewhere in that range. And that means that 2,000 people out of 6 to 700,000 people is around 0.3% of the state's population. So in that one day, I don't know the exact date, but it was sometime in the first 2 weeks of November, 1/3 of 1% of the state tested positive for this virus, all on that same day. But not only was that day bad for COVID 19, that entire month as a whole, especially the month of November, but also the month of October to a certain extent, those months were really bad for COVID 19 across the country as a whole, but especially in the Dakotas, especially in North and South Dakota. The last thing I would like to point out now in this video is that after the peak of this outbreak took place in early to mid November, to the point where North Dakota had over 1,000 people in the state testing positive for the virus every single day, you actually see it get better for the last couple of weeks of November and for the first week of December. And up until the last couple of days, if you exclude that one day in the past week where we had over 2,000 cases in a day, it actually seems to have gotten a lot better for North Dakota. That's actually really weird when you think about it because most other states in this country are still doing really badly with this virus. If you look at the daily case count for the country as a whole, it is worse than ever now. We consistently see over 200,000 cases per day across the country when in October and November it was only 100,000 or less than 100,000 per day. So in the country as a whole, it's at its peak, but in North Dakota, it seems to have gotten a lot better. That could be the reason why we're seeing the decrease in the daily case count. It's just that so many people have already gotten the virus that now there's not enough people left for this virus to infect. Once again, I'm not an expert on this. I'm just giving what I think is the reason why this is the case. But if you think it's for some other reason, feel free to leave it below in the comments. I'm not claiming to be an expert. I don't know much about this virus. I'm just a kid who's given my own opinion on what I see.